Good morning. For this week's version of the VC Notes, we have a segment of our VC Coffee Talk. And today I'm delighted to have with me Dr. Lisa Didion. I want you to hear a little bit about her and her background and about her role as the Chief Medical Officer and how she views that role here for the Medical Center. So, Lisa, thank you for joining us. We're glad to have you today. So tell us a little bit about your own personal background, your personal background, kind of your professional career. How did you get to the point where we are here today?
Yeah, it's been a journey for sure. I'm originally from Iowa. I did my medical school and residency training at the University of Iowa and left there after my chief year. I was chief resident of pediatrics, left there in 2009 and was at the Medical College of Georgia for a couple years before coming to UMMC in 2011. Originally came to UMMC as a pediatric hospitalist. I was a worker bee. And with that, really kind of learned, I'd say that's where I learned the most about teams and how care is delivered at the bedside and how myself as a physician really influenced the operations of a hospital. And I think that kind of innate interest of mine is kind of what's led me into these roles that I've been in at the University of Mississippi.
So when you were a resident and doing your pediatrics residency and learning all things peds, did you have that inkling at that time, this sort of interest? Would you have imagined that you were going to grow up and be a chief medical officer? Or were you just sort of trying to take good care of your patients and get through the next day and the next week?
Great question. I think, I honestly saw myself in the education side when I was a resident, and that's actually why I did a chief resident year. Every chief resident year is a little bit different at every academic center. At the University of Iowa is a very education focused, a lot of time with medical students and residents, and that is where I saw myself. Like I said, I think it was really when I came to the University of Mississippi Medical Center and was a pediatric hospitalist that it all kind of began to click for me. And what really got my interest was really the operations side of the hospital. I found one thing I thought of immediately as a medical student is how do things really get done? And that was my first question. Okay, I put in this order for a chest x-ray on a patient.
What happens now?
Yeah, and this was, back we still put orders on paper, right? So how did the radiology tech know that I wrote this order? How does the radiologist know the chest x-ray got done? So I had those questions early on in my training, but didn't really bubble up to maybe this is what I could work on professionally until I got here.
So in your current job, you do pull a lot on that education interest you have because I feel like a lot of what you are doing is educating all of us, the entire campus, about what happens in a chief medical officer's office and all the pieces of the operations. I remember the first sort of moment that I had that bit of realization like you described was around actually a medication error, and this was years ago. And a medication was ordered and I can't remember if it was the wrong dose or the wrong medicine was given, but I was part of a team that went through a process, which I'm sure you're very familiar with, but detailing out the steps of what happens from the time a medication order goes in to the medication is actually delivered. And there were so many steps and so many places where something could go wrong. It really is fascinating when you think about it, and just multiply that over thousands and thousands of times in all the activities that occur in a hospital delivering care to patients. And especially in an academic medical center where everything's a little bit more complicated than in other centers. So when you think about, or at least when I think about a chief medical officer, my sense is if you look at the person who's in your job at all the different places, just to narrow it down a little bit from the scope of all the possibilities to all the academic medical centers, much less all the hospitals in the world, it's probably different at every single place, a little bit different. You certainly, I feel like, are conducting yourself and focusing on things that are a little bit different than the initial focus with Dr. Henderson. So he was our first, I would say, full-time chief medical officer. We did have people in the role before, but I feel like he was sort of that first kind of full-time, we're going to establish this office. And he did it one way, and now you're taking us a little bit different. We learned a lot. Talk to us just a little bit about why that is, from your role to the next person, to the next person, to the next person, why it's different. What is a chief medical officer?
Yeah,
what would you say to people who, from the outside looking in and don't know what this is?
Yeah. Well, and I think I've had a lot of practice at that question because that's what my family asks all the time, right? And, and when I try to put it into just one sentence, I kind of say, our job, it's not really my job, but the chief medical office job of that team is to really make sure that we as an organization are putting the patient first and foremost.
I like that.
And there's lots of ways to do that. And certainly the first thing you would think of is quality and safety. And Dr. Henderson, that was his primary focus. And that's what the organization needed at that time, 100%. And he had the expertise we needed for that. The level of knowledge was awe-inspiring, I think, and he taught all of us as leaders a little bit of that knowledge, to kind of help the next generation. For me, that is still the number one priority of the CMO's office, and that will always be our job, is to help develop that strategy for quality and safety. But beyond that is this whole idea of value, which we've started down that path with the strategic plan. And that, to me, is all about teamwork, efficiency, and effectiveness. And that, when you think about my clinical life as a hospitalist, that's what a hospitalist is all about. How can we be efficient and effective and work well with the team? And so that is just innate to me. And I think that will be the little bit different flavor that I'll have and that the office will bring forward. And it's this idea of moving the operations of the hospital from a value perspective a little bit further along with quality. And it's that whole value equation. It's quality over cost. And the way large organizations like ours control their cost is by being efficient and effective. And the best way to do that is through teamwork. And so we talk a lot about team care and influencing that culture of, delivering healthcare at the bedside as a team. Your example of the medication error, what I love about this job is there's a lot of people that work behind the scenes that influence the care at the bedside. There's a lot of people, when you put a medication order in, when I put a chest x-ray order in, that maybe the patient doesn't see, or the physician or the nurse doesn't see, but they touch that order and influence its outcome. And I love that part. And I like highlighting those disciplines, those team members. I've done that in a few areas across the organization, and that to me is the fascinating part, the behind the scenes.
It is amazing when you think about it, how many people it takes and how many different jobs it takes for the patient to get the care that they deserve and they need and that they receive. And all those people you mentioned that may never walk in the patient's room and the patient never sees them, but are critical steps along the way. So I think you were 100% just dead on when you said, what Dr. Henderson brought to us when he came is exactly what we needed. It was sort of the building blocks. And now we're ready for that next step, and that's where you're taking us. I think it's, at least in my mind, it's not quite as defined because it's a broader scope and a broader spectrum. And I know people sort of look at what they think of chief medical officer, and there are all the different pieces, and they've heard about hand hygiene and safety and the x-rays and getting the right meds to the right patient. And now they're talking about documentation and how is all this lined up? How does it all mesh together to make us better? I think lots of people know, superficially at least, that this is somehow tied to our leapfrog scores and those other things that we all pay attention to, the publicly reported scores about quality. in some ways, we have to learn as an organization, and we have been, and we are with your leadership, learn about what those external entities look at, and to be sure that we are paying attention to those things, and that we do have our processes in place, and do have all the steps behind the scenes lined up so that we get the credit for the quality of care that we give. I hear a lot from friends and people in the community. Some I know, some just reach out to me, I don't know them, but who will share stories about care they received here, either they or their families or somebody they know. And every once in a while I get complaints, but lots and lots of times people are talking about how wonderful everybody was, and those caregivers at the bedside, and what a difference it made, and just saying very positive things. But little do they know what it takes to kind of get to that point. I think it's been an amazing journey and a wonderful journey. When you think about the next few years and sort of what you maybe hope to accomplish, or what you see as our most important priorities or initiatives, tell us about some of those.
Yeah, I think the priorities are pretty similar initially. Our number one priority is patients, and we want to deliver high quality care at the bedside, have great outcomes, keep our patients safe. And a lot of what you just mentioned, that idea of what is the experience that our patients have. And I think we have done a much better job recognizing, acknowledging the patient experience. And that actually drives a lot of those letters, positive or negative, that you may receive. And so it's really important that we recognize that. It's not all about the objective outcomes that we have. There's a little bit of subjective piece to quality, and that is the patient experience, and that idea that we treat them with empathy, and that we treat each other with empathy, and that's part of the culture that we want, that patient-centered culture. I think the vision for me moving forward is this idea of how do we use the platform, the infrastructure that we've developed for our quality improvement initiatives, and expand that into all of hospital operations. And one of the ways that we're working on that is through the development of the Office of Operational Excellence. And it's just that, how do we support all aspects of the hospital, whether it's EVS, finance, pharmacy. It goes much more beyond hospital-acquired infections, hand hygiene, complications, and really influencing that idea of value. And it's much broader than just quality.
So give us an example how you think or you envision that the Office of Operational Excellence might impact something that's outside of the patient safety or hand hygiene. For somebody who's thinking, what in the world is that? What might that mean in a little bit of a broader sense?
Yeah, I think a great example would be length of stay and patient flow. I think that is a hot topic.
We've had a little problem with that.
Yes, it is a hot topic. We talk about it all the time.
Ooh.
And, we've talked about this a lot, that some of it is things internal for us to work on, but there's a lot of external forces that affect our capacity and length of stay issues. But the Office of Operational Excellence can support that work by, again, using the tools we've used in quality. Number one is defining a problem and maintaining a scope of work. We do this a lot. We kind of creep out what the initial plan is, and that just kind of derails us, extends the project. And having, folks in the Office of Operational Excellence that are experts in running a project, they keep us in line, right? And they make sure that we have achievable goals, that we have data, that we're data-driven. That's another thing that's really important to reach our outcomes. And length of stay is a huge one. And really what we need to do is be strategic and identify the little projects within there. It can be a little mind-boggling to look at it. But I think that's one example that most people would understand.
Yeah. It is one of those challenges we have that is, just on the surface, it seems like just such a big challenge. And the idea of breaking it into the components that feel a little bit more manageable and a little bit more definable gives you the sense that maybe we can make a dent in this. We have been struggling with this for a long time. There's a huge demand for our services, both in the outpatient setting and the inpatient setting. You know, day after day after day, we have lots of admissions that we're holding down in the emergency department that are waiting for a bed. It's a wonderful problem to have, but it's one of those problems that that I'm eager for us to be able to tackle just a little bit.
Absolutely.
I know that that's a big part of the work. What are the things that kind of keep you up at night? What worries you the most when you're thinking about this big job, because it's a big job? What do you feel worried about, or maybe worried's the wrong word, but what keeps you up at night when you're thinking about challenges at work?
You know, I think the healthcare industry, the people that work in healthcare, it's a vulnerable industry. It's humans doing very, high intense, high risk work. And so I honestly, some of the things that keep me up at night is just the well-being of our workforce. And that I understand and you understand that we're all working in a high risk environment, but until something happens to a patient, a bad outcome, sometimes that may be the moment that a frontline worker really understands that. And we as leaders, I think, need to do a better job of, highlighting that and saying, we've got your back, we're here to support you. One of the ways that we have their back is developing systems of safety. Again, we are all humans, we are all going to make errors, but it's those systems that are in place that prevent the error from reaching the patient. And I want to do my best in leading that work because I want to keep our frontline workers, number one, safe, but confident in the work that they do, and protect them. Because I think nobody comes to work wanting a bad outcome to happen on their watch. And how can we in the CMO's office protect that a little bit? And I think this is a challenge all healthcare organizations face. And I think that's the thing that really kind of keeps me up.
Yeah, that is, you're right on target with the challenge that we have there. I agree with you. I think people show up to work with the intention to do a good job, and obviously they care about what they're doing, or you wouldn't work in a place like this if you didn't have your heart in it and what have you. This is not an easy place to work. We have the sickest patients, and you're always busy, always a big demand. But mistakes do happen, things do happen. There are patient outcomes that aren't what we want them to be, sometimes because of nothing anybody did, but because of the disease process or the illness that the patient has. But no matter what, it's the kind of thing that really is impactful to the people that's involved. And I appreciate your comments. I think you're exactly right. For the people that are taking care of patients day in and day out and giving it all they have, to be able to support them and provide as much infrastructure as possible so that outcomes are as high quality and as excellent as they can be. I think that's
and it really, we've talked a lot over the last several years about becoming highly reliable. And it's, healthcare really is a high risk game, just like it is the airline industry, the nuclear power industry. These are kind of well-known, highly reliable organizations. And that infrastructure, we feel like in the CMO's office, that's the infrastructure we need, is what are the things that we need to have in place to become highly reliable. And, we know this, the three pillars, leadership, culture, and performance improvement, and really bringing those pillars of high reliability to the front line is going to be really important to get there.
I think we've made great strides in the last, 8-10 years, maybe even a little bit longer. And the work ahead, we've still got work to do, but it feels like we've got good progress and systems in place we didn't have before, and a good plan and a good path forward. And from what I can tell, I think that the organization as a whole, and certainly all the people that make it up, are glad that we're on this journey. You know, there's a everybody's busy, and it's kind of hard always to squeeze in that one more thing or go to a meeting or you know, what have you. But it feels like there is a readiness and an eagerness around the organization to do this work and to take these next steps. Do you feel that? Do you feel like you're kind of part of a train that's moving, or are you trying to get the engine started?
No, I feel like we're on our way as well, and I think actually a little bit of the silver lining of the COVID pandemic actually is highlighted the need for this, and I think even the lay public about, you know, the high risk area that healthcare is, that hospitals are, and I think definitely that's the front line is more knowledgeable on that. I think that is where we need to be. I think leadership has been on board. It's just how do we filter down to the front line? And I think COVID helped a little bit with that. And I think, you know, COVID really educated our patients as well.
I think so.
And this idea that I may not need to go to the hospital. Maybe, you know, I can go see a clinic doctor. It's changed kind of the culture around healthcare a little bit, and I think that's been one of the good things that's come out of the pandemic.
Yeah. So for the students and faculty and staff, you know, this goes out in the campus-wide VC notes, and a huge audience sees this, as well as some of our external partners. Is there anything that I have not asked you that you would want to be sure that they hear you say, or that you'd like them to hear from you, something you wanted to cover that I haven't asked about so far?
I mean, I think we've covered all kind of the big points. I think what's important to me, and I know everybody else in the CMO's office, is that we are here to serve our patients. We want the patients to be our first priority, but understanding there are other priorities out there that we need to be knowledgeable on. You mentioned the reputation scores, so Leapfrog and our star rating, but also how our outcomes influence payment and reimbursement from our payers. And I think this idea of being patient-centered, a culture of team care, efficiency, effectiveness, I think those are words that people will hear from me and other folks in the CMO's office frequently. And, you know, our goal, I tell our team in the CMO's office, and Dr. Henderson would preach this as well, we lead by influence. And the way that we are able to influence folks is by developing trust. And so that is always my goal, is to develop appropriate relationships, collaborate, and develop trust with the people that I work with. And I think we need to do that as leaders, with our front line, with our patients, all the above, and that's how we're going to get the work accomplished.
Well, I have confidence in your ability to do that and your ability to lead us through these next steps. So thank you for being willing to take on this role and step into it with such strength and the great foundation that you have. And I love how on multiple questions that I asked you, the answer was keeping the patients as the focus, because that really is, as an organization, the way we need to think. The patient comes first. If we didn't have patients, we wouldn't need to do research and the scientific discovery work that we do. We wouldn't need to have schools where we're educating students if it weren't for the patients. So thank you for keeping the patient front and center. That is critically important.
Thank you.
So in closing, I just want to share with people that recently, to speak of Dr. Didion and her initial interest in education and what education was all about, we recently have had commencement, and we had 915 graduates from the medical center in all of our health professional schools. So it's been a wonderful time to celebrate them and the next steps that they'll be taking. Some students enrolled in our schools are moving this year from one part of their program to another. Some have graduated and are going to be moving out into the state and all across the country to either take care of patients or to further their career in research. So we're awfully proud of them and awfully glad to see them progress in their careers. It's been a wonderful year for research. We've had lots of positive news and lots of great outcomes. And then in the patient care area, as you've heard, we're making strides in some work that's really, really important. So no matter what your role is here at the Medical Center, I want to thank you for all that you're doing and for your part in the successes that we're having here this year. Thank you.